We have learned our abdomen card, and we start with the abdominal wall, then inguinal region, then we have learned something about the esophagus, stomach, and the vessels like celiac trunk. And then we have learned the spleen and pancreas. Next topic is the duodenum. Duodenum is the continuation of the stomach, and the continuation of the duodenum is the jejunum. It is the small intestine, part of the small intestine. But here we learned the duodenum with the pancreas and spleen, not with the jejunum and ileum, the other parts of the small intestine. We learned this duodenum with the pancreas and spleen as because these three viscera remain in a single chunk of soft part. In the software examination, you may ask to hold this viscera and you have to describe all the things. So in the item card, it is arranged in like this manner. Now we will learn the duodenum. Duodenum is the continuation of the stomach, and it is C-shaped. It has 4 parts: first part, second part, third and fourth part. Interesting thing is that duodenum, the length of this part is 1 inch, 2 inch, 3 inch and 4 inch. The first part is 2 inch, second part is 3 inch, third part is 4 inch and fourth part is 1 inch. This is the peculiarity of the duodenum, and this duodenum remains mainly in the right side of the abdomen. We will see the duodenum in the picture. This is the first part, this is the second part, this is the third part, and finally this is the fourth part. This duodenum is the continuation of the stomach, and it remain in a C-shaped manner, enclosing the head of the pancreas. Here is the superior duodenal flexure, and here is the inferior duodenal flexure. In between the superior and inferior duodenal flexure, this vertical part is the second part of the duodenum, and this horizontal part of the duodenum is the third part of the duodenum. In the living body, we can see here is the stomach, and the continuation of the stomach is the pylorus. After the pylorus, this is the starting of the duodenum. If we see the section through the duodenum, here we see the pylorus, cut section through the pyloric part of the stomach. Here is the first part of the duodenum, here is the second part, third part and the fourth part. Here we see there are some folds, mucosal fold within the duodenum, and here in the second part of the duodenum, here we see there is a papilla. This is known as the major duodenal papilla, where the ducts open in the second part of the duodenum. There is another papilla that is known as the minor duodenal papilla. Here is the cut section of the lower end of the stomach. This is the pylorus. From this pylorus, there is the continuation of the gastrointestinal tract. This is known as the duodenum, and this is the superior duodenal flexure. From here, the second part of the duodenum starts. Up to this is the first part of the duodenum, and the length of this first part is the 2 inch or 5 centimeter. We can divide these into the proximal 1 inch or 2.5 centimeter and distal 1 inch or 2.5 centimeter. And here we see that the proximal part of this first part of the duodenum is related with the this is the greater omentum in the inferior border, and the superior border it is attached with the lesser omentum, and the distal part of the duodenum, first part of the duodenum is retroperitoneal. Peritoneum is related with its anterior surface, and in the relation we can see the posterior part of this first part of the duodenum. Duodenum is related with, we can see there are some structures. Here we can see this is the portal vein. This is the portal vein, and here is the gastroduodenal artery, and this is the common bile duct that is related with the posterior part of the first part of the duodenum. In the anterior part, we can see here the reflected part of the stomach. Here stomach is reflected, and we can see this here there is the gallbladder. Here is the gallbladder, and this part of the liver is related with this first part of the duodenum. Here we can see this is the stomach, this is the pyloric end of the stomach, and this is the duodenum. And this gallbladder remain in this anterior part of this first part, and this part of the liver, that is caudate lobe. This is the related with the anterior part of this first part of the duodenum. Now the second part of the duodenum, it starts from this superior duodenal flexure and ends up in this inferior duodenal flexure, and it is right side of the midline and related with the first lumbar to the third lumbar vertebra. And it is vertical in orientation, and it is related with this. This is the picture, in situ picture. Here is the first part, this is the second part. It starts from here. Here the in front of the second part, we see there is the transverse colon. Here is the transverse colon, and the transverse colon is attached with the transverse colon is attached with this structure. This is the transverse mesocolon. Here is the transverse. It is anterior to the second part of the duodenum. And the liver, here is the liver. If liver is here, liver is retracted upward. If it is allowed to settle down, it will remain in this anterior part of this second part of the duodenum. And sometimes the coils of small intestine remains in this anterior part of this second part of the duodenum. In the posterior side of the second part of the duodenum, we can see here is the posterior part of the abdomen. Here we see there is the inferior vena cava. Here is the renal vessels, kidney. All the things remain in this picture. We can see this is the second part of the duodenum. Here is the left kidney, and the renal vessels in this level. Here is the left kidney and renal vessel at this level. So the behind the second part of the duodenum, there will be the renal vessels and the left kidney. And here we see there is a muscle. This is the psoas major muscle. This is the psoas major muscle that will remain in this behind. Here is the second part, behind the second part of this duodenum. So in the second part, in the posterior relation, we can see the left kidney, renal vessels, psoas major muscle, and the inferior vena cava. These are the posterior relation. And the medial relation, you can see this is the head of the pancreas. It is the head of the pancreas in medially, and laterally there is the kidney. We can see there is the kidney, and in situ picture we can see here there is the lateral side of this second part. There is the right colic flexure or hepatic flexure. It is in the right side of the second part of the duodenum. The third part of the duodenum is related anteriorly with this superior mesenteric vessel that passes from the abdominal aorta, then passes in front of this third part of the duodenum. Here we can see there is an area that is devoid of peritoneum. All that part of the duodenum is covered anteriorly with the peritoneum. So duodenum is a retroperitoneal viscera. This part is devoid of the peritoneum, and here is the attachment of the mesentery. The mesentery, we will learn it later, what is mesentery. And now we can see that the mesentery is attached in this part of the duodenum, and the mesentery, the intestine is attached to this abdominal wall through this mesentery. Here is the transverse mesocolon, that means transverse colon is attached with this posterior abdominal wall through this line. This is the transverse mesocolon, and here is the mesentery. It is anterior to the third part of the duodenum. So third part of the duodenum anterior relation is the superior mesenteric vessel and the mesentery, and superior part is related with the head of the pancreas. And posteriorly, here we see the posterior part again. Here we see the posterior abdominal wall, and here will be the third part of the duodenum. Here we can see, here is the third part of the duodenum, and here the structures that are remain here. Here is the gonadal vessel. This is the right side, so this is the right gonadal vessels that will remain in the posterior side of the third part of the duodenum. Here is the this yellow structure is the ureter, so it is also related with the third part. This is the right side, so right ureter. And the psoas major muscle also in here. This is the psoas major muscle, and here is the inferior vena cava and the aorta. All the things will be related with the posterior relation of the third part. And the inferiorly it is related with the coils of the small intestine. And the fourth part, it is here is the fourth part. Fourth part is not so much visible. Here is the fourth part. Here is the fourth part, and it remains behind the stomach. It remains behind the stomach, and in the posterior aspect of this fourth part, it is related with the left side, left renal vessels and the left ureter. All the things in the left side. So second part is related with the right side, and fourth part is related with the left side.